Hello Marlin, Dr. Marlin Almgren, who works with us in Esher. Welcome.
Thank you.
Today we just want to talk a little bit about the state of children's teeth and gums in the Esher area. Because you have been experiencing and seeing lots of families, and I'd like you to share your findings with us, please. So, how would you say that the state of the gums are of the children of Esher, Marlin?
Well, I was surprised to notice that it varies quite a lot.
Okay. In what way? What do you mean?
Well, you have children who are absolutely excellent, but there are quite a large number of children I've noticed who struggle a bit with their toothbrushing. Oh
right, and how does that show up in the mouth, Marlin?
There are several little clues that we can pick up on. One, of course, is the most obvious, that there are food still sitting on the teeth.
Oh right.
Underneath that you might find plaque and even tartar in quite a few cases.
What sort of ages have you been detecting this, Marlin?
Well, it can be as young as 5-6-year-olds already. Wow. You've seen quite a lot of tartar build-up. Tartar is, by the way, a build-up of plaque that calcifies over time if it's not removed regularly, which in the long run can lead to gum disease. So it's important that we try to remove all of that and show people properly how to look after their teeth.
And what happens if you don't remove it and you do get gum disease? What difference does that make?
Well, if you're unlucky, that can ultimately lead to tooth loss.
Oh right, okay, so it's really important we keep an eye on it. Okay, and so how often should children brush their teeth and why? You say you can remove the tartar with brushing, or is it plaque that you can remove with brushing?
Yes, it's plaque that you should be removing with your toothbrush every day, ideally twice a day. If the plaque is not removed properly, that can then turn into tartar by getting calcified.
Okay.
Then it's very hard to remove with just a toothbrush, then you need extra help from us.
Oh, okay. So what would happen to remove that calculus, the tartar?
Or you would come for a hygiene appointment where we would first of all show you as a patient and a parent where these problem areas are, so that you know what to look out for when you assist your child in their toothbrushing. Then we would find some clever instruments where we would remove the tartar from each tooth one by one until it's free, and then polish the teeth so they become smooth and the build-up doesn't come back so quickly.
Wow, sounds very minty and fresh. And how often should children, or adults even, be brushing their teeth?
So twice is the recommended ratio. Once in the morning and once at night before you go to bed. That's the most important time.
Why is that then?
Well, when you sleep at night, your body functions in general go down to a much slower pace, and that includes your saliva flow.
And why is saliva important, Marlin?
So overnight, when there isn't a lot of saliva, our mouths become dry, and anything that lingers on the teeth have full growing grounds, really. So to remove all plaque before you go to bed, and also supply your mouth with fluoride, which comes from the toothpaste. Fluoride is a building block and can prevent decay. So that's important that you have a daily supply of fluoride too.